Hi everyone, it's Jane Rachel from Undiagnosed again, and I'm here again with my physical therapist, Kristen from FemFirst Health, and we're talking about pelvic floor dysfunction. Kristen, in the last video, first we even explained what a pelvic floor was, and we talked a little bit about pelvic floor dysfunction. First, about how many women experience this?
About a third of women have some type of pelvic floor dysfunction throughout the course of their life.
Wow, that's actually a lot. And
Yeah.
is it something that only women experience?
Men also have a pelvic floor, so they can experience some different symptoms, but if they sit the wrong way for too long, for too many years, or have a sports injury, they can also start experiencing pelvic floor issues.
And when should someone see a doctor?
Pain with sex is not normal. Leaking is not normal, and any pain in your pelvis is not normal. So you should get that checked out right away. And you can either go see a gynecologist, a urologist, or start by seeing a pelvic floor physical therapist.
And what are some of the things that they would do for you? Either a doctor or a physical therapist?
They can do any specific testing that they feel is needed, or they would probably give you a prescription to go see a pelvic floor physical therapist as well.
Okay, and what does a pelvic floor physical therapist do? I mean, I go to physical therapy for my back and my neck. Is it the same thing, or is it?
So we do a really specific history to kind of figure out what are those drivers into what created the pelvic floor dysfunction.
Okay.
And then we actually do an internal exam. So we can go in vaginally and check all the muscles, and then we can also do a rectal assessment as well if needed.
And if you find a problem, would you be able to tell on exam whether something's too tight or causing leaking?
Yes, and we'll be able to test strength if needed.
And you strengthen just like any other muscle. It can be strengthened through like exercise or stretching.
Exactly.
It's just, I think in this society we think because it's like a part of the pelvic area that it's different from another muscle, but it sounds like it's just like a muscle like any other.
Yeah, I think there's a stigma associated with talking about our private parts.
And if you're saying that it actually happens to a third of all women, then it's something that we should be talking about.
Exactly.
So if anybody out there is in the New York State or New York City area and is having any of these symptoms, I really recommend going to Kristen at FemFirst Health because she's just an incredible physical therapist and one of the most knowledgeable people I know on this topic.